Today we are going to talk about QRS complex and nomenclature of the component waves which make the QRS complex. In a classical ECG, we can see that this is QRS complex. First of all, how QRS complex is produced? Basically, QRS complex on ECG tracing is graphic representation of ventricular depolarization. Let me repeat it. What is QRS complex? QRS complex is a graphic representation of electrical activity of the heart when ventricles are undergoing the process of depolarization. When the ventricles are undergoing the process of depolarization. When ventricles are undergoing the process of depolarization, certain electrical forces are generated. Those electrical forces, when they are graphically recorded by ECG recorder machine on the paper or on the monitor screen, that complex which results is called QRS complex. Now, QRS complex may have one wave or two waves or three waves or sometimes more than three waves. Right? Now, what is a wave? Wave is when there is deflection away from the isoelectric line. All those deflections which are above the isoelectric line, they are called positive waves, and all those deflections which are below the isoelectric line, they are called negative waves. Is that right?
Yes.
What did we talk about? That during ECG recording, positive deflections are all the deflections which are above the isoelectric line are positive waves, and which are below the isoelectric line, they are negative waves. But before we really go into detail, we must know what is isoelectric line. What is isoelectric line or baseline in ECG? Actually, usually students answer in different way. Some students tell that isoelectric line is PR segment. Some students tell me isoelectric line is ST segment. But really, isoelectric line is this one. This is T wave and this is next P wave. Isoelectric line is the line between the T wave and extending from here up to the onset of next P wave. Because isoelectric line is drawn by the pointer. ECG recorder's pointer draws the isoelectric line when there is no electrical activity in the heart. When there is no electrical activity in the heart. Now, this is atrial depolarization. This PR segment, this represents when current is passing through AV node. Is that right? Then QRS complex represents ventricular depolarization. Very good. And then ST segment represents the electrical activity in the heart when after the spread of the ventricular depolarization there is plateau phase, right? And then this is rapid phase of ventricular repolarization. But once at the end of the T wave and before the next cardiac cycle start, the needle should rest in a neutral position, and the line which will be drawn, this should be considered isoelectric line. So isoelectric line is basically TP segment. What is isoelectric line? We can say isoelectric line is TP segment. Right? Now, why I don't consider PR segment or ST segment as isoelectric? The reason being, in certain pathological conditions, PR segment or ST segment may get elevated or depressed. So they cannot be used as a reference. Did you get it? Again, I will repeat. For a reference, if we have to use a reference point for positive and negative deflections, we must use that segment which is mostly stable, right? So TP segment at the end of the one cardiac cycle, electrical activity of the one cardiac cycle, and before the electrical activity of the next cardiac cycle start, in between them, when pointer of ECG recorder remains in neutral position without any deflection, the line which is drawn is isoelectric line or baseline of ECG. Of course, mostly or in healthy subjects, PR segment and ST segments remain at the same level as isoelectric line. But as I mentioned, in different pathological conditions, these two segments can elevate or depress, but TP segments remain stable at its neutral position. Once you know that, now onwards, when I will use the word isoelectric line, right, I will mean the level of TP segment. Let's go back. When we are concentrating on the nomenclature of QRS complex, right, we should know which component of the complex is deflected above the isoelectric line and which component of the complex are deflected below the isoelectric line, because nomenclature depends on multiple factors. Number one, nomenclature of QRS complex depends on direction of the deflection. Is it positive wave or negative wave? Secondly, nomenclature depends on the position of the wave. If there are three waves, how they are positioned in reference to each other, according to that we will label the waves. And number three, degree of deflection. There is small deflection or large deflection. Again I will repeat, there are three basic parameters on which we determine the nomenclature. Number one is point A, that we have to talk about the direction of deflection, right? Point number one, that is it directed upward above the isoelectric line, it will be positive wave. Below the isoelectric, it is negative wave. Second thing, it also depends on the position of wave in the complex. Position of a wave in complex. As I will tell you, the initial negative deflection is given a different name, but after the positive deflection, if there is negative deflection, that is given a different name. Is that right? And third factor which is used in this is amplitude of deflection. Amplitude of deflection. That if deflection is small, then it is represented by small letter. If deflection is large, it is represented by capital letter, right? For example, it is small deflection, and if I call it Q, then it will be small letter. And it's a large diffraction. If I have to represent by R, it should be written in capital. Is that right? So there are three basic components that when we are going to name the waves, we have to see the direction of deflection, we have to see the position of deflection within the complex, and we have to see the amplitude of the deflection. Is that right? Now let's start with very basic principles. There are how we designate the different name. Number one, these are the three factors. These are the three factors which influence the nomenclature. Now we go to the principles of nomenclature. The first principle of nomenclature is, or first rule of the nomenclature is, that in the complex, the initial negative wave, negative wave is labeled as Q wave. Now someone from the student said it should be small q. No, it may be small or it may be large, depending on the amplitude of the wave. Depending upon the amplitude of the wave. So let's correct it. So initial deflection, right, in the complex, if there is initial negative deflection, that initial negative deflection may be called Q wave if it is small, or capital Q if it is large. Right? Am I clear?
Yes, sir.
Then number two, rule number two. The first positive deflection in the complex is called R wave. The first positive deflection is called R wave. Again, it may be small r if it is small in amplitude, or it may be capital R in uppercase if it is large in amplitude. Is it clear?
Yes, sir.
Third rule. Third rule is, again, first was initial in the QRS complex, initial negative deflection is Q wave. First, what is that? Positive deflection is R wave, and negative deflection after the R wave. Negative deflection which appears in the complex after the R wave, that is labeled as S wave. So, what is this? Negative deflection after R wave, either small or large. After R wave is S wave, either small s or large s, depending upon this was Q and this is R. Now this is the simplest form of QRS complex, so classical Q, R and S. Another way to say the same rule is that in QRS complex, if you find an upward deflection, it should be labeled R. In the QRS complex, when you find the first positive deflection, it should be labeled as R wave, and any wave before the R is Q, and any wave just after the R is S. Another way to mention these three rules is that when you look at the QRS complex, first identify the R wave if it is there. Any negative deflection before the R wave is Q, and any negative deflection after the R wave is S wave. Is it clear?
Yes, sir.
After these three rules, then I will mention another situation. But before I go for that, let's compare this. I will just develop QRS, draw to QRS complex. This is one QRS complex. Now let's invert it. We already know this will be labeled as Q, R, S. What about this one? Who will tell me? Yes, doctor.
The first positive deflection is R.
Very good. The first positive deflection should be R. It is the small r, of course. First positive deflection should be considered R, but because it is small deflection, I am writing it in lower case. Is that right? It means here the R is without Q, because there is no negative before the R. And then, yes doctor, what is this wave?
Negative deflection after R wave.
Yeah, this is negative deflection after the R wave. So it should be
S wave.
S wave, small s, large s? Large s, very good. And then what should be this? Yes. Okay, let me tell you before you get more confused. Here's now one more rule. Right? The rule is that if you have second positive deflection within the QRS complex, if you have second positive deflection within the QRS, that will be labeled as R prime. Right?
Yes.
So what is that? Second positive deflection within QRS complex, first positive is R wave. Second positive is R prime. Of course, either small or large depending upon the deflection. Depending upon the degree of amplitude of deflection. Then, now let's suppose I draw another complex here. What is this? Now you will tell me. Yes, doctor. This is which wave?
First positive deflection is
This very good. First positive deflection should be R, but capital. And this is?
after R wave.
There is
Negative deflection is S.
S wave. Very good. And it is large deflection. And then there is R prime. Okay, let me modify it further. Now, how you will label this wave? Remember, previously, this was S wave. And what is this wave now?
Another negative reflection.
It is another negative deflection, and actually this negative deflection is after the R prime. So it should be considered S prime. S prime, P-R-I-M-E prime. So what I really wanted to put in your mind, that of course it's very easy to remember just QRS. This nomenclature is easy. The first positive is R wave, and any negative before the R wave is Q, and any negative just after the R wave is S wave. Done? Then we came to know this thing, that here, what is there? There is no Q wave, because there is no initial negative deflection. But first positive is R wave, after that negative is S wave, and after that if still one more positive appears, then it is R prime. Then we go in further detail. Again, first positive is R wave, it is followed by a negative which is S wave, again followed by second positive deflection, that is R prime, and then followed by another negative after the R prime, that is S prime. So negative wave after the R is S, and negative wave after the R prime is S prime. Is it clear? Any question? No. So once you have, so what is the fourth principle here? Second positive deflection may be R prime, small r prime, or capital R prime, and of course then is that S, and negative deflection after R prime is S prime, depending upon size. I hope now you can identify properly. Now, once you know these four principles, now I will come to another thing. I said simply that small deflections, yes, small amplitude deflections are designated by small letters like Q or R or S or R prime or S prime. Right? And large deflections are designated by capital or uppercase letters. That is, either they are called Q or R or R prime, or of course in between that there should be S, very right, QRS, and then there may be R prime or S prime. I hope these rules are clear, right? Some authors believe, how do you define that there is small deflection or large deflection? Some authors believe that when deflection is more than 3 small squares, it should be considered large deflection, and when deflection is less than 3 small squares, then it is, the amplitude of deflection is less than 3 small squares, then it should be considered small deflections, right? Now, just for practical purposes, I will draw some QRS complexes and you will rapidly label them, right? This is the classical what you see, right? What is this? Q, R, S complex. Then I will again repeat, yes. What is this? R, S capital, R complex, right? Then I make what is this? R, S, R prime complex. Then I'm going to make one more, it's just for practice. So if you find difficulty in labeling, let me tell me please. Then we can make it like, yes. What is this? R, S, R prime, right? Now, you can see all of these complexes, okay, start from here. All of these complexes, they have how many waves? Those. 3 waves, right? All of these are having 3 waves. So these complexes are called triphasic QRS complexes. What are they called? Triphasic QRS complexes. So these are triphasic. Now we come to another situation, just for practical purposes. Put it here. Yes. If this is, now what is this? This is Q and this is R complex. And if I make it like both are large. So what is this? Q and R. You get it? So actually this nomenclature help when you are one doctor is talking to other doctor and other doctor doesn't have tracing in front of his eyes and you are going to explain the QRS complex. So if you say there is small q and capital R, this image should be produced in the mind of trained doctor, right? And if you say there's capital Q and capital R wave, QRS complex is capital Q and capital R, of course then it is. So just both of them are called QR and QR complex, but actually they are different. So you need to mention it's a small letter or capital letter. Is that right? Now we come to another arrangement. What is this? Q and R. Now all of them are QR. This is QR, that is QR, that is also QR. But here both of them are large. Both deflection, negative and positive, are large. Here negative deflection, initial negative is small and first positive is large. Here initial negative is large and first positive is small. And then if deflection is like that, what you will call it? This is R, very good, small r and s. Or if I repeat it in a different way, then what is it? QS complex, QS complex, good. So I think you are really learning. QR, yes, very right. It means you have really learned, very good. QR, right? Now I come to another set of complexes. Let's suppose here. What is this complex? RS. Now you see RS is different than QR. In QR, negative deflection is before the first positive. And RS, negative deflection is after the first positive. Right? Then we make another arrangement. What is this? R small s. And if we make another arrangement, what is it? Small r and capital S. Now both of them are RS. But when you designate which one is small and large, then you can differentiate these complexes even by hearing on the telephone from other doctor. Is that right?
Yes.
And what is this one? Small r and small s. There are small deflection, positive deflection followed by one negative deflection. Is that right? Now note, all these deflections, how many waves are there in all these QRS complexes? 2. So these are called biphasic deflections. What are these called? These are biphasic QRS complexes. Right? These are biphasic QRS complexes. Right? Sometimes you come across something like this. you find just one positive deflection, and before that there's no negative, and even after that there's no negative. What you will call it? Just R wave. Very good. Or this will be capital R, and what will be this? Small r. Right? This lecture is dangerously simple, isn't it? Yes, you have a...
Will we not use word QRS complex?
Wow, that is very good question. Excellent question. He says, here, will we use the word QRS complex or not? Answer is yes. We'll say there is QRS complex which has only R wave. We will use the word QRS complex by convention, having only R wave. And of course, you are very right, this will be considered monophasic. And now tell me, what is this? If you come across a deflection like that, what is it? Is it Q wave or S wave? It is negative deflection. Now, my intelligent doctors are going to tell me, is it Q wave or S wave? You think it's Q wave? Yes. You also think Q wave. Why you call it Q wave? Because Q wave must be before the R wave. Is there any R wave?
But it is first initial negative.
It is initially negative, but not followed by positive. Yes. Initial negative is the only initial word is used when it has followed by something. So, is it Q or S? The problem is, now concentrate. To label a negative wave as Q or S, you must have R. But sometimes you come across a QRS complex which doesn't have positive deflection. Then what to do with this single wave? Actually, because we cannot label as Q and we are not sure is it Q or it is S, so we become a little tricky. So what do? We just call it QS wave. We call it QS wave. Is that right? Clear? And of course, and if there's little small deflection, what is it? QS wave. Now in this case, again we will say, here's QRS complex which has only one negative deflection, or we can say QRS complex consists of QS wave. Here QRS complex consists of just R wave. Remember one thing, when we use the word QRS complex, it does not mean that Q, R and S, all three must be there. QRS complex is name given to any wave complex produced by ventricular depolarization. It may consist of one wave or two wave or three wave or even more waves. Is that right? So these are also QRS complex, but these QRS complexes are having only deflection, positive or negative, so we call it monophasic QRS complexes. Monophasic QRS complexes. Right? Any question up to this? Okay, now I will draw something here and you will help me to label it, just as a test. Yes. What will be this? R. And if it is small r, small r. And what is this?
S.
Large s. And what is this? R prime. And what is this? S prime. Right? Now I will draw one more complex. Just I want to see how you label these. This is a very unusual presentation, but anyway, what is this? Q, R, what is this? R prime. And if you draw the isoelectric line, then it is going below the isoelectric line, it is capital S. And if it is small one, make it very good. This is small s prime. So I hope you are clear about it. Is there any question? Okay. Once the nomenclature of QRS complex is clear, right, I will make it a rapid review. QRS complex is a term used for the graphic presentations on the ECG tracing which represent ventricular depolarization. Done? Yes. QRS complex may consist of one wave or 2 wave or 3 waves or more than 3 waves. And as either it is 1 wave or more waves, it is still called QRS complex. When there are multiple waves in the QRS complex, how do you label the waves? For that purpose, you have to see that waves are positive or negative. All waves which are above the isoelectric line are considered positive deflections. Positive waves below the isoelectric line are negative. Isoelectric line is basically TP segment, classically speaking, more accurately speaking. Clear? Then, if there is a positive deflection, the first positive deflection should be called R, and any negative before that should be Q, and any negative after that should be S. Clear? Then, if there is small deflections, they should be designated by small letters. If the large deflections, they are designated by capital letters, right? Then, if there is second positive deflection, it should be considered R prime. And if there is negative deflection after the R prime, that should be considered S prime, right? Any question up to this? Then, generally, we can divide different types of QRS complexes depending upon the number of waves constituting. If there are 3 waves involved in that, we call it triphasic complexes. If there are 2 waves involved, we call it biphasic complexes. If there's only 1 wave, positive or negative involved, it is monophasic. You must remember, if there's only positive, it is called just R, but complex is considered QRS. And if there is only negative deflection, it should be called QS wave. The reason being there's no R wave to help us to designate as Q or S. So we call it QS negative wave, right? Any question up to this? Class dismissed. Yeah, here I want to highlight one thing. Why I taught QRS nomenclature in such a detail, because in future lectures, the next 2 lectures, one lecture will come QRS complex in the chest leads from V1 to V6, and the next lecture will come QRS complex in limb leads. Once we are done with these next 2 lectures, then we will go to the clinical side of the ECG. No question? Class dismissed.